All right. Hello, everyone. Welcome to our latest webinar from our Queen Elizabeth Scholarship Program in Strengthening Health and Social Systems. My name is James, and we're coming to you today from the McMaster Health Forum in Hamilton, Ontario, Canada. A short, quick agenda for our presentation today. Sorry about that. I'll give you a quick introduction to the McMaster Health Forum, a little bit about our Queen Elizabeth Scholarship Program. Then I'll introduce you to our current scholar who will be doing her presentation today, which is Natalie, who traveled to South Africa. So the Master Health Forum is a leading hub for improving health outcomes through collective problem solving. We harness information, convene stakeholders, and prepare action-oriented leaders, and act as an agent of change by empowering stakeholders. The Queen Elizabeth Scholarship Program, or the formal name being the Canadian Queen Elizabeth II Diamond Jubilee Scholarship, is managed through a unique partnership of Universities Canada, the Rito Hall Foundation, and Community Foundations of Canada, and the individual Canadian universities. This program is made possible with financial support from the Government of Canada, provincial governments, and the private sector. The purpose of the scholarship program is to activate a dynamic community of young global leaders across the Commonwealth to create lasting impacts both at home and abroad through cross-cultural exchanges encompassing international education, discovery and inquiry, and professional experiences. Each of the Queen Elizabeth Scholarship programs across the country are unique. The Master Health Forum has proudly been selected as one of 20 Canadian institutions to host the second round of scholarships, which runs from 2018 to the end of 2021. The focus of the Master Health Forum's current QES program is strengthening health and social systems. Our scholars will contribute to strengthening health and social systems and become part of our large and growing network of health and social systems leaders. Our previous Queen Elizabeth Scholarship Program, which focused solely on health systems, hosted 14 scholars who were international students. We sent 3 scholars abroad to various partners around the world. And in a much larger list, we sent 14 interns abroad to Commonwealth partners around the world. Our current Queen Elizabeth Scholarship Program, which again is health and social systems, we currently have hosted 4 incoming scholars, and we have sent 7 interns abroad at this time. Our scholar presenter today is Natalie. Natalie is an undergraduate student in the Bachelor of Health Sciences program at McMaster University. She's just finishing up her 4th year. She has an interest in improving the accessibility of research evidence in healthcare services for vulnerable populations. And during her internship, Natalie hoped to gain insight on how evidence is synthesized and modified in response to the changing needs of policymakers. So it's my pleasure to present to you Natalie, who will be taking over from here. Natalie, go ahead.
Hi, everyone. So as James introduced me, my name is Natalie Tchakerian, and I'm in my 4th year in the McMaster Health Sciences program. And in the fall of 2019, I had the pleasure of visiting South Africa and interning at the Africa Center for Evidence. And today I'll be sharing with you my experiences in the work I completed while I was abroad. Okay. So in today's webinar, I'll be giving first a brief interview to the Africa Center for Evidence, and I'll also describe the various roles I played as an intern. So I worked on the CEE map, the Africa Check project, I worked on translations, and I also attended government conferences and some meetings, which I will go through. And I will also share some of my experiences that I was fortunate enough to have outside of work, and end off with a short message for future interns who may be watching. So what is ACE? ACE stands for the Africa Center for Evidence and is a research organization based at the University of Johannesburg and the Bunting Road campus. This organization was founded in 2016, and their mission is to reduce poverty both in South Africa and Africa as a continent through the use of evidence. We have 4 main portfolios where they focus their work. First one is arts and science, and evidence capacities, evidence communities, and evidence synthesis. And here's a picture of one of the ACE research houses on the university campus where I spent most of my time. Here's a group picture of almost all members of ACE, plus me on the bottom left. The director of ACE since its inception is Ruth Stewart, and she's standing 2 rows above me on the left, waving her hand over there. As you could probably tell from the photo, the work atmosphere at ACE was very welcoming, and everyone there instantly made me feel like I was part of their family. My role at ACE as an intern consists of many different responsibilities. My first month was spent working on the Africa Check project. Then I moved on to work on the collaboration for environmental evidence map. And I also completed translations for one of their websites. I also helped build a database of rapid response services that I will go through later. And I joined my colleagues in attending conferences throughout the city. So starting with the Africa Check project, this project was funded by Africa Check, a nonprofit organization that promotes high quality information and makes it available for everyone in Africa to access. Due to the staggering amount of fake news and misinformation floating around the internet, this organization has become very valuable in fact-checking as a tool for researchers, journalists, and the public in general. The project that we were working on was actually started by a previous QES intern that was interning at ACE in the summer of 2019. There were 3 parts to this project. The first part was the completion of 2 country essays on the impact of misinformation in the media and politics on public health and democracy. So one essay on South Africa and the other one on Nigeria. The second part consisted of 2 policy guides, the first one on health misinformation in Africa, Latin America, and the UK, and the second on education and news literacy programs in Africa around the world. Keeping in mind the time for today, I'll be sharing more about the findings that we found from the first 2 parts of the project that focus mainly on health misinformation and politics. So here's a summary of the findings from both country essays on the impact of misinformation in the media and politics, both on public health and democracy. So to summarize, in South Africa, a significant number of South Africans had admitted to sharing political news on social media despite believing that it could actually be false news. And the racially divisive political climate both enabled and exacerbated the potential for harm from the spread of misinformation. And this was particularly impactful in times of elections. And the majority of South Africans were not satisfied with democracy and had little trust in the parliament to begin with. Similarly, in Nigeria, a significant number of Nigerians had admitted to sharing political news stories on social media despite believing that they were actually false or could be false news. And the ethno-cultural and religious divisions within society appeared to both fuel and spread misinformation during election times and exacerbate the potential for harm. The majority of Nigerians actually did not think that they could access information from their local government due to a limited awareness of the Freedom of Information Act in that country, which actually allows every single Nigerian to request information from the government if they need to do so. If you want to read more about these the findings, you can see links provided underneath each country to read more about the essays that we published on the Africa Check website. So moving on to the other policy guide that we completed, this one was based on the impact of health misinformation in Africa, Latin America, and the UK. So in Africa, health misinformation affected both rates of polio vaccinations in 2003, as well as the containment of the Ebola virus in 2014. So polio cases in Nigeria in 2003 made up more than 80% of cases in all of Africa. And vaccination efforts were hindered by false claims made by religious leaders that argued that the vaccine was actually causing infertility, HIV, and cancer. So it didn't take much time for people to connect these conspiracies to thinking that it was the government's way of regulating population growth. In fact, these rumors actually spread from the northern part of the country all the way to the south through more word of mouth and speculation. The media then reported these claims without fact-checking, and this resulted in 3 states of Nigeria to boycott the vaccine altogether. During the Ebola virus outbreak in 2014, Liberia in particular was recording a staggering number of deaths that occurred in homes rather than in hospitals. This resulted in a team from the Centers for Disease Control and Prevention, so the CDC, and the Ministry of Health to conduct a rapid assessment in the country to understand the reasons behind this. It was found that Ebola was believed to be a fake disease in Liberia, partly due to the fact that the disease's symptoms mimicked familiar symptoms, but also due to conspiracy theories published in local papers and spread through word of mouth. This resulted in a large number of people dying at home from Ebola rather than in hospitals. And the mere fact that people believe the conspiracy theory is a consequence of the government's poor initial response to the epidemic and an indication of the deadly effects of misinformation in times of public health emergencies. In Colombia in particular, HIV and AIDS has always been associated with stigmas that have acted as barriers to seeking treatment. However, our findings showed that social stigma, religious affiliations, and misleading names had all been reported to delay treatment. In the UK, we looked at vaccinations and how health misinformation affects vaccination rates. So the UK had received measles elimination status from the WHO in 2017. But in 2018, 600 confirmed cases were identified again in England and in Wales. And researchers wanted to see why this was happening. So they conducted a research study and they asked parents, they presented parents with a fictitious disease and provided information about a vaccine before they had to complete a questionnaire. Results revealed that there was a significant negative relationship between anti-vaccine conspiracy beliefs and the intention to vaccinate. And a following study exposed parents to materials supporting anti-vaccine conspiracy theories or anti-conspiracy materials and showed that those who were exposed to anti-vaccine conspiracy theories showed less intention to vaccinate. So I worked on that project for Africa Check until mid-October, and then I moved on to working on the Collaboration for Environmental Evidence Map, which has been an ongoing project that was started in 2018. And multiple QES scholars have actually worked on this project since its inception, so I was very happy to be part of it. ACE is currently in the process of mapping the full environmental evidence base for South Africa, and in time, this map will become the basis for a responsive evidence service offered to the South African National Department for Environment, Forestry, and Fisheries. So where are we right now in the process? The process to create such a large-scale map is complicated. While I was at ACE, the screening of more than 100,000 articles was completed, and 6,000 were now eligible for inclusion. The next step in the process will be gray literature searching, and the grueling task is building a framework for coding and extracting data from these 6,000 articles. The framework will be constructed with the help of a group of expert stakeholders and partners in the field in order to ensure that all the relevant information from each article is included in the final map. Many people have put in countless hours of hard work into this project, and I'm really looking forward to seeing the final product soon. Some other tasks that I was also responsible for during my time there was the translation of the Africa Evidence Network website from English to French, since I'm fluent in French. And the Africa Evidence Network, or the AEN, is a Pan-African network of nearly 3,000 people who share a vision to see the end of poverty and inequality in Africa. Their mission is to work with others to contribute to this vision by increasing the use of evidence in decision-making. So because many countries in Western Africa are primarily French-speaking and are part of the AEN, they were not able to access the information on the website since they can't read it in English, and they will now be able to access the information. Following the work of previous scholars, I also helped to expand a database for global rapid response services around the world to make this information public for researchers to utilize. And actually, the McMaster Health Forum Rapid Response Program was actually included in this database. Other conferences I attended 2 government conferences. The first one was the 4th Annual Biodiversity Research and Evidence in Daba in Pretoria. And the second was the 1st Annual Gauteng Environmental Research Symposium, which was in Johannesburg. The QES program allows students to not only gain academic experience abroad, but to also explore new cultures and places while meeting new people along the way. And outside of ACE, I had the opportunity to explore what life was like both in Johannesburg and in other cities in South Africa. I put together some pictures here from some of the moments from my QES experience that were very memorable. So starting from the top left, this is a picture of my last day at ACE actually during our year-end social, where we spent the day outside eating traditional Afrikaans foods and saying our goodbyes. And throughout this page or this screen, you can see the smiling faces of all the people I had the pleasure of working with every day, and we still keep in touch to this day. Right below that picture on the left is a picture from the Apartheid Museum. And for those who are unfamiliar with apartheid, it was a period of 50 years of racial discrimination in South Africa against non-whites and was enforced across the country. It was a period of great suffering, which ended with the formation of the democratic government in 1994, led by Nelson Mandela as the leader of the African National Congress. My experience at the museum was very eye-opening and emotional, and although I could see remnants of apartheid across the city to this day, it was not until I visited the museum that I could understand the pain that this country had endured for decades. For those who may visit South Africa in the future, this is definitely a must. Other things that were going on while I was there was also the Rugby World Cup, where South Africa was in the finals against England, and the country was really excited about that because South Africa won for the first time in 12 years. So lots of parties going on that weekend. And other significant events included the implementation of load shedding throughout the country by South Africa's major power source, which is called Eskom. And for those who don't know, load shedding happens when there's not enough electricity available to meet the demand of all customers, and the energy supply must be interrupted in certain areas for a certain number of hours. And this had not happened in South Africa for quite some time, which enraged the public as businesses rightfully found it hard to keep up with intermittent power. So other things that I did on a long weekend, I actually visited Kruger National Park and saw the Big Five. In Africa, the Big Five game animals are the lion, the leopard, the rhino, the elephant, and the buffalo. So there are some pictures on the left over there. And right before returning home to Canada, I visited Cape Town and met a lot of people from around the world that I still keep in touch with. So there's some pictures on the right from there. But the people in the middle of the screen are the ones that made my experience in South Africa the best it could possibly be. And these were the people I interacted with and worked with every single day. A big sincere thank you to them and everyone at ACE. They not only welcomed me into their institution, but also into their homes and showed me a new way of living. And I'll never forget their kindness, their hospitality, and their patience with me as I was learning to adapt to a new workplace. If anyone's interested in seeing more photos, my Instagram page is also added here where I shared more photos from the QES experience. So my information is almost done, but I just wanted to add a little slide for future interns that may be watching the webinar. And I wanted to include the pictures here on the left because the first picture was right before I was leaving to go to South Africa. So that's Pearson Airport in Toronto, where I was scared and nervous. And then the picture on the bottom is a couple days before I was returning home. I just wanted to show like the difference in my self-growth and just tell people that it's a really good experience to have and it's important to make the most out of it. So a couple messages is to just be open to new experiences and learning opportunities. When I got to ACE, the work that was given to me was not something I'd done before and it was completely out of my comfort zone. But I went with it with an open mind, and I'm so grateful for the opportunity that I was given because it forced me to learn something new and something I would not have learned if I had stayed at McMaster for my entire undergrad. And also, don't be afraid to go on adventures on your own and take this time to learn more about yourself while you're there. So for more information on my work and my experience in South Africa, please feel free to read my 2 blog posts that I wrote while I was in South Africa. First one is on the ACE website, and the second one is on the CE Johannesburg website. And a final thank you to the Queen Elizabeth Scholarship Program, the McMaster Health Forum, specifically James McKinley for his mentorship and guidance, and of course the Africa Center for Evidence. If anyone has any questions about this webinar or my time at ACE, you can ask me now, or you can also contact me at my email provided below. Thank you.
Wonderful. Thank you very much, Natalie. Excellent presentation. And loved all the pictures. They look like you had a great time. And so we have a number of people online. If anybody has any questions they would like to ask, this is an opportunity to do it. I would ask you put your questions in the chat box, and then we'll put them on the recording for Natalie to respond to. While you're thinking about your questions, Natalie, I'll ask a quick question. I found the results of the Misinformation project very interesting and telling in the sense that, you know, vaccinations cause certain other elements, and the fact that certain diseases, in that case Ebola, is a fake illness. We hear those things in the news here in Canada as well. So I'm just curious what you learned during that project that you can now kind of relate back to Canada, and what solutions we may have here that may help battle that misinformation that we see.
Right. So I think during times of Ebola, especially in Africa, it was hard for the government to really relay their messages clearly and like broadcast them to everyone in mass media campaigns. Whereas in Canada right now, most people have access to Public Health Canada on their phone. They're watching the news at night. So there's big differences in that. But in Liberia with Ebola, it was difficult because all the news was being passed along through word of mouth. So as we know, like every time you tell a story, it gets changed every time it moves from one person to the next. So this was really detrimental in during the Ebola crisis in Africa. But some lessons to be learned in Canada would be, I think Canada is actually doing a good job at this by even airing commercials between news programs or TV shows. They have like a short segment from Public Health. You know, that's a trusted source. It's Dr. Teresa Tam from Public Health Canada who's talking and giving us reliable information. I think as long as people are looking at reliable sources from the government, I think people will be okay. And I think people are following the guidelines properly.
Great, thank you. So people online have some questions. So the first question that I see is about your time in South Africa. So what surprised you the most about your time during your trip to South Africa?
Good question. Thank you, Kathy. What surprised me most? I would say how different the work environment is, I would say. Obviously, I didn't know what to expect once I got there, but it was very different from back home in Canada, other places I've worked as well here in Ontario. But I would say it's very more laid back, a lot more focus on just like being outside. You can take your work outside if you'd like. You can do work from home. You can also work from home here, but there's more flexibility in that way, which I did not expect at all. I would say just the country in general surprised me. I thought it was going to be a lot more different than when I got there, but it was easy to adapt to.
Great, thanks. Any other questions for anyone? Feel free to, again, put them in the chat box. Evidence maps is something that the McMaster Health Forum might be looking at doing more in the future. What do you see as the biggest benefit of having those evidence maps available? Like, how do you think they're best used?
So before I'd gone there, I didn't really know much about evidence maps, but the first weekend I got there, I went to that conference in Pretoria where they presented the first kind of introduction to the evidence map to the people that were attending the conference. So I got to learn more about it. And it was really interesting actually how the evidence could be mapped into different categories, and then you can see how many articles are published in each subject in each part of the country. So because South Africa is very diverse in its biodiversity, you can see, especially like from the south of the country, what evidence is available on one specific subject. So land degradation, for example, compared to the northern part of the country, where the same research could show completely different results. So I think that's really important for countries diverse, like Canada as well, is very diverse. So research on land degradation in PEI, for example, will be very different from land degradation in BC. So I think it's really important to map that evidence in that way.
Great, thank you. Last call for any questions for anyone online. Last one from me, Natalie. As you noted, still a lot of French is spoken in Africa. I'm wondering if you came across any French in South Africa at all while you were going about your business.
Oh yeah, so I was hoping that I would come across some French, but actually South Africa has 11 languages, official languages, but French is not one of them. So very few people spoke French, but when I attended some conferences where government officials were there, there were some people from Senegal who spoke French, so I got to speak a little bit of French with them. But other than that, no, South Africa does not speak French too much, unfortunately.
Great. And did you find that in the French dialect was any different for people who were, African-speaking French, or
Yeah, yeah, definitely.
was it? Yeah.
Very different. Yes, very different. But it's kind of more like France speaking than Quebec.
Gotcha. Okay.
Mhm.
All right. Well, I don't see any other questions online, so I think we can draw this to a close. So thank you very much for those of you who joined us today. Thank you very much, Natalie, for your presentation. We really appreciate it. For those that have an interest in the Forum's Queen Elizabeth Scholarship Program, the first link that you see on the screen there will take you to all the information you need to know about it and how to apply for it. For a full list of presentations and webinars just like this one, please go to the second link online. That's on the screen. And then for blog posts, we have a number of our scholars write blog posts, as Natalie did as well, and we put those on our QE Scholar blog post pages, the third link there. So feel free to follow us on social media through Twitter, Instagram for some of our scholars, a little bit of Facebook work as well. And other than that, thank you very much for joining us today. Thank you again, Natalie, and we will connect with everyone again soon.
Thank you.